Assalamualaikum. Good day. I am Armelina M. Masdan, third year college Bachelor of Science in Nursing. So we are the group 1 from the Libra B. So today I will going to discuss about the disorders of the pancreas. So what is pancreatitis? So pancreatitis, this is the inflammations of the pancreas, is a serious disorder. So, when pancreas inflame, so it may damage our tissues. So the inflamed pancreas, it can cause the increase of inflammatory cells and toxins, uh, and also may harm our lungs, kidneys, and the heart. So, okay. Next, so the most basic classification system used to describe or categorize the various stages and forms of pancreatitis divides the disorder into acute pancreatitis and chronic pancreatitis. So, acute pancreatitis range from a mild, so self-limited disorder to a severe, rapidly fatal disease that does not respond to any treatment. So these two main types of acute pancreatitis, mild and severe, so are classified as interstitial edematous pancreatitis and necrotizing pancreatitis respectively. So this acute pancreatitis, this is a mild and also mild and severe. So when you look at the picture, you can see the pancreas when it is inflamed. So acute pancreatitis, you can see the inflamed pancreas because of the gallstone blocking the common bile duct after the pancreas duct has joined. Okay, next. So pathophysiology. Pathophysiology, self-digestions of the pancreas by its own proteolytic enzymes. So proteolytic enzymes, these these enzymes will break down the protein. So it made by animals, plants, fungi, and also the bacteria. So principally like trypsin, so causes acute pancreatitis. Other less common causes of pancreatitis include the bacterial or the viral infections with pancreatitis, occasionally developing as complications of mumps of viral infection. So these mumps viral infections, you can see here swelling on the area of the parotid gland. So in alcohol consumptions, use of tobacco products is a risk factor for the development of acute and chronic pancreatitis. So yes, and one of the when you are using tobacco, like using cigarettes, so it will cause your pancreas, maybe for the acute or the chronic pancreatitis. Then clinical manifestations. Severe abdominal pain is the major symptom of pancreatitis that causes the patient to seek a medical care. So abdominal pain and tenderness and back pain result from the irritations and edema. So clinical manifestation. So the major symptoms of pancreatitis that causes the patient is the abdominal pain and also the abdominal pain and the back pain. Assessment and diagnostic findings. So the diagnostic of acute pancreatitis is based on a history of the abdominal pain, the history of the patients about the abdominal pain, the known risk factors, physical examination findings, and also the diagnostic findings. So the serum amylase and lipase levels, as you can see at the picture. So the serum amylase and the lipase test. So these levels these are used in making the diagnosis of the acute pancreatitis. Then so this serum amylase returns to normal within 48 to 72 hours, while the serum lipase levels may remain elevated for a longer period, so often days longer than the amylase. So medical management of acute pancreatitis is directed toward relieving symptoms and preventing or treating complications. So All oral intake is withheld to inhibit stimulations of the pancreas and the secretion of enzymes. So, all oral intake to is allowed to um, uh, allow for the also for the stimulations of the secretion of the pancreas and also secretions of enzymes. So ongoing research has shown positive outcomes with the use of the enteral feedings. So the current recommendation is that whenever possible, the enteral route should be used to meet nutritional needs in patients with pancreatitis. So it is recommend when you are going to use the enteral feeding, so you should be use the nutritional needs for the needs of the patients with pancreatitis. Okay. Next, so for the pain management. So pain management, you can use the is pain relief may require the parenteral opioids. So parenteral opioids, this is for administering like subcutaneous, intramuscular, and also the intravenous, such as morphine, fentanyl, sublimase, or the hydromorphone. Then the respiratory care. Respiratory care, so aggressive respiratory care is indicated because of the high risk of the elevations of the diaphragm, pulmonary infiltrates and effusions, and atelectasis. So, respiratory care. So it is important for the patients who have the pancreatitis. So, this respiratory care is a supportive care which includes the replacement of the fluid and electrolytes and also the corrections of the metabolic abnormalities. Intensive care, so this is the correction of fluid and blood loss and low albumin levels is necessary to maintain fluid volume and prevent acute kidney injury. So intensive care, so as a nurse, you need to give an intensive care for the patients if the patient has a blood loss and low albumin levels. So it is important to maintain the fluid volume and also to prevent the acute kidney injury. Biliary drainage. So this biliary drainage through endoscopy has been performed to establish drainage of the pancreas. So this has resulted in decreased pain. So using endoscopy, so through endoscopy, this is a non-surgical procedure to examine the patient's digestive tract. So it involves inserting along the flexible tube into the throat or esophagus. Okay, next, surgical interventions. So surgical interventions, although the acutely ill patient is a high risk for surgical complications, the surgery may be performed to assist in the diagnosis of the pancreatitis to establish the pancreatic age. So you see, so this is surgical interventions using the surgery. So if there is a patient for the high risk, acutely is high risk, so you need for the surgical interventions, and also to assist to diagnose the what kind of to prevent to diagnosis the pancreatitis. So post-acute management, oral feedings that are low in fat and protein are initiated gradually. So caffeine and alcohol are inhibited. So you need to avoid the caffeine and also the alcohol for the diet of the patients. Next is nursing management. So nursing management is relieving pain and discomfort. So because the pathologic process responsible for pain is an autodigestion of the pancreas, the objectives of therapy are to relieve pain and grief. So because the because of that, so you need to if you have the autodigestion, so the pathologic process is responsible for the pain of the patients that cannot digest so, and also for the you are doing the relieving pain for the decrease and also the process for the to relieve pain. So improving breathing pattern. So the nurse maintains the patient in a semi-fowler position to decrease the pressure on the diaphragm by the distended abdomen. So this fowler position, the fowler position is to is used for the patients have a difficult breathing. So you use the semi-fowler positions for the patients or to maintain the difficulty breathing of the patients. Improving nutritional status. The nurse assesses the patient's nutritional status and notes factors that alter the patient's nutritional requirements like temperature, mother age, like that. So as a nurse, um, you need to assess the nutritional status of the patients. So next is maintaining the skin integrity. So the patient is at risk for the skin breakdown because of poor nutritional status. So enforced bed rest and restlessness, which may result in pressures, ulcers, and breaks and tissues integrity. So if there is a patient at risk for the nutritional status or restlessness, so you need to maintain the skin integrity. Then let's proceed to the chronic pancreatitis. Chronic pancreatitis, this is an inflammatory disorder characterized by progressive destructions of the pancreas. So when you look at the picture, so you can see the chronic pancreatitis, the healthy, and the pancreatitis. So when there is when it's called the pancreatitis, you can see the area of the inflammations. Okay. The clinical manifestations. So, chronic pancreatitis is characterized by recurring attacks of severe upper abdominal and back pain accompanied by vomiting. So, this chronic pancreatitis, this attacks the abdominal, attacks severe upper abdominal and also the back pain accompanied by vomiting. And then assessment and diagnostic findings. So, ERCP, this is endoscopic retrograde cholangiopancreatography is the most useful study in the diagnosis of chronic pancreatitis. So it provides details about the anatomy of the pancreas. So this ERCP is the most useful to study the diagnosis of the chronic pancreatitis. Okay, and then the management of chronic pancreatitis depends on its probable cause in each patient. So it depends on the probable causes in patients for the medical management. Non-surgical management. So non-surgical management approaches may be indicated for the patients who refuses surgery. So it's a poor surgical risk or when the disease and symptoms do not warrant surgical intervention. So non-surgical management. So this non-surgical, as you all know naman. So non-surgical, we are not using the surgical. So this is for the patients who refuse surgery. So it may be poor surgical risk if the patients refuse it. So, and then the pancreatic cyst. So this pancreatic cyst, as a result of the local necrosis that occurs because of acute pancreatitis, collections of fluid may be from close to the pancreas. So these fluid collections become walled off by fibrous tissues and are called pancreatic cystosis. So pancreatic cyst, if the fluid collections become walled off by the fibrous tissue, it is called the pancreatic cystosis. So the cyst, this is the as you can see the cyst there on the pancreas. So that pseudo. So that cyst you can see there is pseudocyst. Okay. So that's all for my topic. Thank you.
So, pancreatic cancer is the 9th common cancer in women and 10th most common cancer in men in the United States, and rates have been increasing over the last 10 years. About 45,200 cases per year in the USA has been diagnosed in 2013. So, the pancreas is the digestive system organs that located in the upper abdomen. So there are two functions, which is the endocrine and exocrine. So the endocrine is the pancreas produces the chemicals, hormones that regulate the blood sugar. Like for instance, insulin, glucagon, somatostatin, or pancreatic polypeptide. While the exocrine is the pancreas produces enzyme that help digest our food, like amylase, protease, and lipase. So for the pancreas anatomy, the pancreas is divided into three regions, which is the head, the body, and the tail of pancreas. So symptoms of pancreatic cancer. So few symptoms early on the illness develop the non-specific due to less time. So most of the time, pancreas cancer is often diagnosed in late diagnosis stage. So what's this? The tumor is arising in the head of pancreas, which is the common symptoms are jaundice or yellowing the skin of eyes, dark urine, pale stool, and itching in the skin or pruritus. So this is the cause of the tumor in the head of pancreas. So the black bile, the liver from the black bile from the liver from reaching the digestive system. So some patients experience of loss of appetite, weight loss, fatigue, and the general non-specific of malaise. And if the cancer is spread or if is it extensive, which is upper abdominal or back pain may be present. So other symptoms is fullness after eating and change in abdominal habits such as bowel movement and new or recent worsening in diabetic. So symptoms may vary a lot between the patients. So like most cancer, the increased risk of developing pancreatic cancers increase with the age, so over 60 years old, as well as the family history of the pancreatic cancer or other related cancers such as colon cancer, breast cancer, ovarian cancer, and prostate cancer are also increased the risk of the pancreatic cancer. So in modifiable risk factors include the cigarette smoking, high fat or low fat diet, overweight and obesity, and working in a job exposing to industrial chemical or toxic metal. So this exposure may increase the risk of developing the disease. So the next is coffee and modest alcohol consumptions are not linked to pancreatic cancer. However, the heavy long-standing alcohol consumptions in predisposed people may link to chronic pancreas and it may increase the risk in disease. So lifestyle changes can help reduce the risk of developing pancreatic cancer, although it is important to mention that no way to preventing the disease is currently proving. So lifestyle changes include the stop smoking and maintaining a healthy weight and reducing the consumption of high-fat food. So if possible, also avoid the exposure to toxic chemical. So for people who at especially high risk, like those with a family history screening program help to try to identify the disease in its early stages when the prognosis is better. So it is recommendation for people at high risk is screening the programs for pancreatic cancer. So that will be all. Thank you.
I'm Miraida B. Mercusin. My topic for today is about cholecystitis. So, cholecystitis, it is a disorder of the gallbladder. So, cholecystitis, it is an inflammation of the gallbladder which can be acute or chronic, causes pain, tenderness, and rigidity of the upper right abdomen that may radiate to the mid-sternal area or right shoulder and is associated with nausea, vomiting, and the usual signs of an acute inflammation. So a person with the cholecystitis, she may be experiencing the sign and symptoms and the feeling of nausea, vomiting, and the usual signs of an acute inflammation. So, cholelithiasis, calculi or gallstone usually form in the gallbladder from the solid constituent of bile. They vary greatly in size, shape, and composition. They are uncommon in children and young adults but become more prevalent with increasing age. It is estimated that the prevalence of gallstone ranges from 5% to 20% in women between ages of 20 and 55 years and from 25% to 30% in women older than 50 years. So, cholelithiasis, it is common in women. Then, the target age is from the 20 years of age up to below 50 of age. So, cholelithiasis affects approximately 50% of women by the age of 70 years. So, the pathophysiology of the cholecystitis, there are two major types of gallstone, those composed predominantly of pigment and those composed primarily of cholesterol pigment stones, probably form when unconjugated pigments in the bile precipitate to form stones. These stones accounts for about 10% to 25% of causes in the United States of developing such stones is increased in patients with cirrhosis, hemolysis, and infections of the biliary tract. Pigment stones that cannot be dissolved and must be removed surgically. So, cholecystitis, it should be removed surgically. So, the clinical manifestations of cholecystitis. Gallstone may be silent, producing no pain and only mild GI symptoms. So, gallstone, sometimes the signs and symptoms is not usually a pill because sometimes it is not producing any pain, only mild GI symptoms. So, such stones may be detected incidentally during surgery or evaluation for unrelated problems. So, madidetect lang na that certain person has a cholecystitis if magpa-check up na siya. The patient with gallbladder disease resulting from gallstone may develop two types of symptoms, those due to disease of the gallbladder itself and those due to obstruction of the bile passage by a gallstone. So if a person with gallbladder disease resulting from gallstone, she may be develop two types of symptoms. First is due to disease of the gallbladder. Second is itself, and second is due to the obstruction of the bile passage by gallstone. So, the symptoms may be acute or chronic. So, sometimes the symptoms may be acute or chronic, malala, or hindi sobrang malala. So, the symptoms of epigastric distress such as fullness, abdominal distension, and back pain in the right upper quadrant of the abdomen. So, epigastric distress, fullness such as full abdominal distension and back pain in the right upper quadrant of the abdomen. So, they can feel the pain in their upper right quadrant of their abdomen. So this distress may follow a meal rich in fried or fatty. So next is pain and biliary colic. If a gallstone obstructs the cystic duct, the gallbladder becomes distended, inflamed, and eventually infected the patient. Develops a fever and may have a palpable abdominal mass. Patient may have biliary colic with excruciating upper right abdominal pain that radiates to the back or right shoulder. Biliary colic is usually associated with nausea, vomiting, and it is noticeable several hours after a heavy meal. The patient moves about restlessly, unable to find a comfortable position. So, pain and biliary colic. If a gallstone obstruct the cystic duct, the gallbladder becomes distended, inflamed, and eventually infected. Develops. So, a person may develop fever, may have a palpable abdominal mass, may have biliary colic with excruciating upper right abdominal pain. The abdominal pain, this is usually the first symptoms na mapifeel ng person who has a cholecystitis. So, next is cholelithiasis, cystic So, this is also under the pain and biliary colic. So, cystic fibrosis, diabetes, frequent changes in weight. So, a person with cholecystitis, she may be encounter cystic fibrosis, diabetes, frequent changes in weight. Resection of disease, low-dose estrogen therapy carries a small increase in the risk of gallstone obesity. Rapid weight loss leads to rapid development of gallstone and high risk of symptomatic disease. Treatment with high-dose estrogen. Women, especially those who have had multiple pregnancies or who are of Native American or use of Southwest, occurs in few patients with gallbladder disease, usually with obstruction of the common bile duct. The bile, which is no longer carried to the duodenum, is absorbed by the blood and gives the skin and mucous membranes a yellow color. This is frequently accompanied by marked pruritus of the skin. So, a person with gallbladder disease, her skin may be yellowish. So, changes in urine and stool color. So, infected person, changes in his urine change and the color of her stool change. The excretion of the bile pigments, maybe the kidneys, gives the urine a very dark color. The feces no longer colored with bile pigments and grayish or clay colored. So, yun na nga. The stool color may change, the urine may change the color. So next is vitamin deficiency. Obstruction of the bile flow interferes with absorption of the fat-soluble vitamins A, D, E, and K. Patients may exhibit deficiencies of these vitamins if biliary obstruction has been prolonged. For example, a patient may have bleeding caused by vitamin K. Deficiency vitamin K is for normal blood clotting. Assessment and diagnostic findings. So, a wide range of diagnostic studies may be performed in patients with biliary disorders. So, the nurse should educate the patient about the purpose, what to expect, and any possible side effects related to these examinations prior to testing. The nurse should note trends in result because they provide information about disease progression as well as the patient response to therapy. So, the assessment and diagnostic findings. So, So, this diagnostic studies may perform in patient biliary disorder. Then, so the assessment and diagnostic findings, the nurse should educate the patient about the purpose. So about the purpose of the assessment and the diagnostic, and also and the possible side effect. Abdominal X-ray. If gallbladder disease is suspected, an abdominal X-ray may be obtained to exclude other causes of symptoms. However, only 10% to 15% of gallstones are calcified sufficiently to be visible on X-ray studies. Then, next is ultrasonography. Ultrasonography is the diagnostic procedure of choice because it is rapid and accurate and can be used in patients with liver dysfunction and jaundice. So the examination used is X-ray and also the ultrasonography. The ultrasonography, it is more rapid and accurate and can be used in patients with liver dysfunction and jaundice. It does not expose patients to ionizing radiation. The procedure is most accurate if the patient fasts overnight so that the gallbladder is distended. Ultrasonography can detect calculi in the gallbladder or a dilated common bile duct with 90% accuracy. Then, next is radionuclide imaging or fluoroscintigraphy. Fluoroscintigraphy is used successfully in the diagnosis of acute cholecystite or blockage of a bile duct. During this procedure, a radioactive agent is administered intravenous, which is taken up by the hepatocytes and excreted rapidly through the biliary tract. And this is also the examination used. The radionuclide imaging or the cholecystography. So, next is oral cholecystography. Oral cholecystography is used if ultrasound equipment is not available. So, this is also the equipment used, the oral cholecystography. It is used if the ultrasound equipment is not available. This study may be performed to detect gallstone and to assess the ability of the gallbladder to fill, concentrate its contents, contract, and empty. So next is nursing implications. An ERCF requires a cooperative patient to permit insertion of the endoscope without damage to the GI tract instructions, including the biliary tree. Before the procedure, the patient is educated about the procedure and their role in it. The patient takes nothing by mouth for several hours. So, nurse implication. Before doing this, the nurse advise or give some feedbacks about this procedure. So, percutaneous transhepatic cholangiography. Percutaneous transhepatic cholangiography is rarely used for diagnostic purpose alone due to the multiple of other less invasive and reliable imaging studies. So, yung PTC, rare lang siya ginagamit. PTC is reserved for those patients in whom an ERCF may be unsafe due to previous surgery involving the biliary tract. The use of PTC has mainly been replaced by ERCF and magnetic resonance colonography MRCF. PTC involved the injection of dye directly into the biliary tract. So, next is nursing implication. Although the complication rate after this procedure is low, the nurse must closely observe the patient for symptoms of bleeding, peritonitis, and sepsis. The nurse assesses the patient for pain and indication of these complications and reports them promptly to the primary provider, takes measures to assure the patient and ensure patient comfort. Antibiotic agents are often prescribed to minimize the risk of sepsis and septic shock. In this, the nurse observed the patient for symptoms of bleeding, peritonitis, and sepsis. So next is nutritional and supportive therapy. Approximately 80% of the patients with acute gallbladder inflammation achieve remission with tests, IV fluids, nasogastric suction, analgesia, and antibiotic agent. Unless the patient's conditions deteriorate, surgical intervention is delayed just until the acute symptoms subside. At this time, the patient undergoes a laparoscopic colorectis. So that's all. Thank you.
Assalamualaikum ma'am, I'm Ledger Kamala 70. Now I'm going to tackle the urolithiasis and nephrolithiasis. As referred to stone calculi in the urinary tract and kidney, respectively, urinary stone predominantly occur in the 35th decades of life and affects men twice a woman. Stones may be developed in one or both kidney and early episodes are increases. So your urolithiasis, also known as a kidney stone, are hard deposit made by mineral salt that form inside your kidney. Diet, excess of body weight, some medical condition, and certain supplements and medication are among the main causes of kidney stone. So nephritis is referred to the presence search of stone in the kidney. They originate in your kidney but can be found at any point in the urinary tract. And the pathophysiology. Stones are found in the urinary tract when the urinary concentrations of substances such as calcium oxalate, calcium phosphate, and uric acid increase. So yung pathophysiology in the kidney stone is showed slow the urine flow, resulting in supersaturation of the urine and also that damage limiting of the urinary tract infection. And the clinical manifestation. Signs and symptoms in the urinary system is dependent on the presence of the obstructions, infection, of edema. So, the signs and symptoms be one or more of the following. So, yan yung mga signs and symptoms ng kidney stone. Severe pain of either side of your lower back and more. Pain of the stomach ache that doesn't go away, and blood in the urine, vomiting, and fever and chills. So, yan yung mga signs and symptoms ng kidney stone. And next, assessment and diagnosis finding. The diagnosis is confirmed by the non-contrast CT scan, blood chemistries, and a 24-hour urine test for measurement of calcium, uric acid, sodium, pH, and total volume may be part of the diagnosis workup. So, dietary and medication history and family. And history of the kidney stone are obtained to identify factors that predisposing that patient to the formation of the stone. So, medical management. So, So, yan yung ginagamit na diagnosis confirmed by the contrast by using the CT scan, blood and chemistries, and 24 hours urine test measurement. And nabibase din sila sa family history of the kidney stone, family history of the patient. And one is medical management. The medical management are indicate the stones, determine the stones type, prevent and prone destruction, control infection, and relief of any obstruction that may be present. So, medical management. So, when you say about nephron is a unit or microscope, is a microscopic structural that functional unit of the kidney. And nutrition therapy. So, what is that nutrition therapy? The nutrition therapy plays an important role in the preventing kidney stone. Fluid intake in mainstay of the most medical therapy for the kidney stone. Unless fluid are contraindicated, the patient with the kidney stone should be drink 8 to 10 ounce glasses of a day daily or have an IV prescribed to kidney urine. So, yan yung Yung nutritional therapy is a play important role to prevent the kidney stone. So, yan yung mga i-avoid at yung diet and kidney stone. So, the calcium stone. What is calcium stone? Calcium stone is the stored patient with the calcium based on the kidney stone. We recommended to restrict calcium in their diet. So, calcium stones are the most common type of kidney stone, a natural chemical found in most foods. So, yung calcium stone is a chemical, mostly is makikita siya or makikita siya sa mga pagkain, pang-in food. So, the one is uric acid stone. For uric acid stone, the patient is placed on lower urine diet to reduce the excretion of the uric acid in urine. Foods high in urine, salt, fish, and anchovies, asparagus, and mushroom and organ meats are avoided to other protein may be limited. So, yan yung mga avoided para di mag-uric acid, yung mga mushroom, salt, fish, and organ meats. So, yung uric acid is formed when your urine is open to acidic. Uric acid can be formed to stone by itself or with calcium. And distinct stone. A low protein diet is prescribed that urine is alkalinized and the fluid intake is increased. May foods contain oxalate. However, only certain foods increase the urinary insertion of oxalate. There's include this strawberries, chocolate, and tea, and peanuts. So the distinct stone is a type of kidney stone made from the chemical called distinct stone. This stone can get stuck in the kidney, bladder, or anywhere in the urinary tract. So yung distinct stone can be stuck in anywhere in the urinary tract. So that oxalate stone, a delicate urine maintain intake of the oxalate is limited. Many foods contain oxalate. However, only certain foods increase the urinary insertion of the oxalate. This include strawberries, chocolate, tea, peanut, and wheat bran. So, yung oxalate stone is the most preventable cause of dehydration and lower urine output. So, whereas other factor in the person's diet can be cause their stone, including high sodium intake and high oxalate intake in the high protein intake. So 18 to 60 to 80% of the kidney stone. And preventing kidney stone. So the nurse should instruct the patient to avoid the protein intake and decrease urinary insertion of the calcium and uric acid and limit sodium intake to 3 to 4 glass day table salt, and high sodium foods should be reduced because sodium completely with the calcium and reabsorption in the kidney. So be aware for the low calcium diet are not generally recommended and except the true absorption of the hypercalciuria. Evidence of the show of the limiting calcium, especially in the woman, can lead to osteoporosis and does not prevent stone. Avoid intake of the oxalate containing food such as peanut, strawberries, and drink fluid, ideally water, and one glass of cranberry juice per day every 1 to 2 hours. So ito yung mga nurse instruct to the patient para ma-prevent yung kidney stone. So avoid protein intake, decrease urinary insertion, and limit sodium intake, and be aware for the low calcium diet are not generally recommended. So the medical management Surgical removal was the major mode of therapy before the advent of the lithotripsy. So, however, today surgery is performed only 1% to 2% of the patient's surgical intervention have indicated if the stone does not respond to other form of treatment. So, surgical management. So, yan yung ginagamit nilang that is called lithotripsy. So, this procedure is used to break up and often remove the stone fragment. So, yung procedure na yan is yung nag-break up and nagre-remove ng stone fragment. So, the patient with the kidney stone assessment. So, ito yung mga assessment. The patient with the suspected kidney stone is assessed for pain and discomfort as well. Yes, assessing this, yung pain and discomfort as well. So, associated symptoms such as vomiting and diarrhea, abdominal distension, the severity, location of the pain are determined along with any gradation of the pain. So, nursing assessment also include the observation of the signs and symptoms of UTI, chills, fever, frequency of urestancy, and observation of the frequent urination of small amounts or anuria. The urine is streamed to the stone or so diagnosis, nursing diagnosis. Based on the assessment data, nursing diagnosis may include the following: acute pain related to inflammatory obstruction and obstruction of the urinary tract, deficient knowledge regarding the prevention of the recurrence of the kidney stone, and the nursing intervention, relieving pain. Severe acute pain is often to present the symptom of the patient with the kidney and urinary calculi requires immediately attention. So, kailangan ng immediately attention. So, period analgesic agent IV or intramuscular may be prescribed and given to provide rapid relief along with the IV and CVT. So that's all for my topic.
Ma'am, and good morning. I am Ali Shariati J. Mahadali, reporting the pelvic inflammatory disease. When you say pelvic inflammatory disease or PID for shortcut, it is the inflammatory of pelvic cavity that may begin with cervicitis and involve the uterus or endometritis and fallopian tube, ovaries, pelvic peritoneum, or pelvic vascular system. Infection which may be acute, subacute, recurrent, or chronic, or localized or widespread is usually caused by bacteria but may be attributed to a virus, fungus, or parasite. Gonorrheal and chlamydial organism are common causes, but most of PID are polymicrobial. Ang pelvic inflammatory disease po ay isang inflammation kung saan ang natatamaan ay ang tinutukoy dito ay yung ari ng mga babae. Bale, pag sinabing pelvic inflammatory disease, ano na siya, generalized na siya, lahat na yon madadala. Kumbaga, tulad ng dito sa picture sa presentation ko po, yung salpingitis, yung inflammation niya ay doon lang sa fallopian tube. While yung pelvic inflammatory disease ay yung nasa baba talaga ng yung nasa baba talaga yung ang na-involve dito. Pag sinabing pelvic inflammatory disease, lahat ng pelvic cavity mai-involve, lahat yung uterus, fallopian tube, ovaries, pelvic peritoneum, pelvic vascular system. Kumbaga, generalize na ito yung pelvic inflammatory disease. And sa pathophysiology na naman, the exact pathogenesis of PID has not been determined. Ang ano daw, ang eksaktong pathogenesis ng PID ay hindi pa natutukoy ng mabuti, but it is presumed that the organism usually enter the body through the vagina. But nag-presume sila ang organism ay pumapasok sa katawan ng tao nang galing sa vagina ng isang babae. Dadaan siya sa cervical canal, and i-colonize na yung endocervix, at saka mag-move upward sa pupunta ng uterus under various condition. The organism may proceed to one or both fallopian tube and ovary into the pelvis. Ang organism daw ay pwedeng mag-proceed sa isang fallopian tube, dalawa yung fallopian tube, or sa dalawa or both fallopian tube and ovaries hanggang mapunta sa pelvis. The bacterial infection that occur after childbirth or abortion, but the pathogens are disseminated directly through the tissue that support the uterus by the way of the lymphatic and blood vessels. Tingnan nyo nga yung bacterial bacterial infection, lumalabas ito during sa pagkanak or pagka nag-abortion yung isang babae. Tas yung pathogen na ay directly dadaan siya through the tissue that dadaan siya kung saan sumusuporta yung uterus by the way of lymphatic and blood vessels. Tingnan niyo nga yung figure 5, 7, letter A is the bacterial infection spread up the vagina into the uterus and through the lymphatic. Nandyan siya, dadaan siya sa baba, ganyan, directly through the lymphatic nodes. When in pregnancy, the increased blood supply required the placenta provides a wider pathway for infection. This postpartum and post-abortion infection tend to be unilateral. Infection can cause perihepatic inflammation when the organism invades the peritoneum. And then in the gonorrheal infection, when you say gonorrheal infection, it is a sexually transmitted disease. Yun po. The gonorrhea pass through the cervical canal and into the uterus, where the environment, especially during menstruation, allows them to multiply rapidly and spread to the fallopian tube and into the pelvis. Bale po, yung gonocosi ay dadaan through the cervical canal hanggang sa uterus, and kung saan yung environment, especially po pag nagme-menstruational yung isang babae, yung babae, doon ang time na ni-allow niya na mag-multiply ng mabilis at saka mag-spread papunta ng fallopian tube at saka pelvis. Tingnan niyo po yung letter B na figure sa figure 57 1B. Gonorrhea spreads up the vagina into the uterus and then to the tube of the ovary. Dadaan yung gonorrhea pataas into the vagina and then sa uterus, dadaan din sa fallopian tube at saka siya sa ovary ng ng babae. And then, the infection is usually bilateral in their instances organism or tuberculosis, and then gain access to reproductive organs by the way of the bloodstream from the lungs. Tingnan niyo po yung figure 57.57.1c. The bacterial infection can reach the reproductive organs through the bloodstream, the hematogenous spread, kung tinatawag na hematogenous spread. And then, one of the most common causes of salpingitis, yung pinakita ko sa inyo kanina, inflammation of the fallopian tube, is chlamydia. Possible accompanied by the gonorrhea. And then, pelvic infection is the most often sexually transmitted. Bali po, yung pelvic infection is the most often sexually transmitted. Bali, nakukuha lang, natatransfer ito pag nagawa mo po, yung partner mo na nag-sexual intercourse kayo po, na may pelvic infection siya, may sakit sa pelvic, posible po makukuha mo yon, ma-infected ka rin kasi nag-sexual intercourse kayo. And then possibly accompanied by ganun, and then but can also occur with a invasive procedure such as endometrial biopsy, abortion, hysteroscopy, or insertion of an intrauterine device. Bacterial vaginosis, a vaginal infection may predispose women to pelvic infection. Risk factor includes early age at first intercourse, multiple sexual partners, frequent intercourse without condoms, sex with a partner with an STI, and a history of STIs or previous pelvic infection. And then, for the clinical manifestation, symptoms of pelvic infection usually begin with the vaginal discharge, dysuria, pelvic or lower abdominal pain, and tenderness that occurs after mens, and postcoital bleeding. Ang symptoms ng pelvic infection ay usually lumalabas siya with the vaginal discharge, dysreunia, and dysuria, and pelvic or lower abdominal pain. At saka ang ibang symptoms ng pelvic infection ay fever, general malaise, anorexia, nausea, headache, at saka possible na pagsusuka. And then, on a pelvic examination, intense tenderness may be noted, and palpation of the uterus or movement of the cervix, ang kung tinatawag na cervical motion tenderness. At saka yung symptoms ay may be acute or severe in a low grade and subtle by Branham et al. 2005, CDC 2015. And then, for the complication, pelvic or generalized peritonitis, abscesses, strictures, and fallopian tube obstruction may develop. Obstruction may cause an ectopic pregnancy in the future if a fertilized egg cannot pass a tubal stricture, or scar tissue may occlude the tubes, and then resulting instability, adhesion, or are common and often result in chronic pelvic pain. They eventually may require a removal of the uterus, fallopian tube, and ovaries. For the medical management, broad-spectrum antibiotic therapy is prescribed. Usually, a combination of cefatrioxine or urosepin, and doxycycline, and metradone and metronidazole or flagell. Women are most often treated as outpatient and monitored carefully. Indications for hospitalization include surgical emergencies, pregnancy, no clinical response to oral antimicrobial therapy, and ability to follow or tolerate an outpatient regimen severe illness. Okay? As a nausea, vomiting, or high fever, and tubo ovarian abscess. Burnham 2015. Treatment of sexual partner is necessary to prevent reinfection. And for the nursing management, the nurses assess for both the physical and emotional effect of PID. The patient may feel well one day and experience bowel symptoms in discomfort for the next day, and then she may also suffer from constipation and menstrual difficulties. And if the patient is hospitalized, the nurse prepare the patient for further diagnostic evaluation and surgical interventions as prescribed. And then accurate recording of the vital signs, intake and output, and the characteristic of amount of vaginal discharge is necessary as a guide to the therapist. And then the nurse administer analgesic agents as prescribed for pain reliever or pain relief, and adequate rest and a healthy diet are encouraged. In addition, the nurse minimize the transmission of infections by adhering to appropriate infection control practice and perform meticulous hand hygiene. And that's all for my report, ma'am. Thank you.